Hello, medical terminology students. Okay, this week we are again doing two chapters. We are going to do the skeletal system, chapter 14, and then chapter 15 is where you're going to learn about the muscles and tendons and like physical rehabilitation. All right, so let's begin. Functions of the skeletal system. This skeletal system in your book starts on page 461. And on page 462, you can see the different not functions, but health professions. The health professions that treating skeletal systems, all different kinds, from surgeons to physical therapists to chiropractors. And then we have the skeletal system functions. Any functions that you can read about there, this picture is on page 462 in your book that show you all the different bones in the body. Structure of the bone, you're going to see these terms in this chapter because even though you have just a bone, there are different areas of the bone. So let's talk about the diaphyses or diaphysis. Diaphysis. And then we have the epiphysis. The epiphysis. We have an epiphyseal plate, which is in between the diaphysis and the epiphysis, and it's a plate that stays open while your bones are still growing in childhood. And then once you're done growing, then that plate closes up. And we have metaphysis. So you can see on here the picture where the metaphysis is, where the diaphysis is, where the epiphysis, the proximal, the epiphysis is, and then on here you can't really see that epiphyseal plate that's seen on X-ray. Here's some other terms that you're going to need to know. Obviously, our suffix is different, so our root word combining form is the same. We have osteo as the combining form. Osteo means bone. And then, so you've got blast, clast, site, and genesis. So an osteoblast. All right, what does it do? Now we have an osteoclast, osteocyte, and osteogenesis. So our bones, just like our blood, they're constantly breaking down and creating new. So when we have an osteoclast, that's where it's breaking it down. It's old, we're getting rid of it. And then you have osteoblast, which regeneration of new bone. Different parts of, sorry, different parts of the actual bone. So we have a term lacuna. We have the matrix, cortex, and then foramen, or sometimes people call it foramen. Different types of joints. The joints are going to be where bone, bone to bone. Whether it's going to be the different joints. There's like different joints like in your brain or your skull and your arms. So we have a fibrous, cartilaginous, synovial. And all of this is on page 465 in your textbook. And then articular cartilage. Flexion, extension of the joints. On page 467, there's some great pictures that show you what flexion and extension. We have abduction, adduction, and all different type of movements. So let's take a look at abduction, meaning away from your main torso. and adduction is going to be towards it. And then we have rotation of our arm. We've got medial rotation, lateral rotation, pronation. Look at the difference between the arm. Pronation, laying down. Supination looks laying up. Circumduction, this is them, putting your arm kind of your shoulder, the whole swing circle. Eversion and inversion, just the way we move our feet. So let's take a look at opposites. So as you can look before, they've got the movements have to do with opposites. So what is the opposite of adduction? The opposite of adduction is abduction. What's the opposite of extension? Extension, and then we have flexion. The opposite of prone is going to be supine. Opposite of eversion is going to be that inversion. All right, so let's identify the differences between the axial and the appendicular skeleton. So the axial skeleton is going to refer to our skull, our rib cage, and then our spine. And our spine, if you look on page 470 right here, there's this picture. It has five different sections. Our top section is our cervical section. That's going to be in our neck. And we have vertebrae C1 through C7. Our thoracic is going to be our chest area. That's going to be the biggest section of our spine. We have vertebrae T1 through T12. And then lower down in the low back area, we have our lumbar spine, and that's L1 through L5. Just below that, we're going to have our sacrum. And then below that, very small, you're going to have your coccyx. Here's the functions of the axial skeleton. You guys can read that on your own. All right, so in these, here we have some terms. Let's write them in adjective form. So we have sacrum or sacral, spine or spinal, thorax or thoracic. And then we have our skull. On page 471, there's 1 through 6. It talks about frontal bones, parietal bones, occipital bones, temporal bones, sphenoid bones, and then the ethmoid bones. You guys can read that. But this picture is on page 472 in your book, and you can see that there are all different sections of our skull. So what's the difference between a maxible and a mandible? Identify and define the root from the following terms. So we got parietal, sphenoid, temporalis, ethmoid, occipital, frontal, and lacrimal. Here's a picture of your upper arm or shoulder girdle. This is on page 473 in your book, so you can see the different bones that make up the shoulder and the upper part of your arm. And then this here shows you your shoulder joint, which has your humerus, and then your radius and your ulna or sorry, not your shoulder joint. Hello, your elbow joint and your ulna and your radius. This here talks about different types of joints. We have a ball and socket, a hinge, and a gliding. Forearm, wrist, and hand. Let's take a look. We've got the bones in The hand, um, it, sorry, the forearm is actually your radius and your ulna. Then in your hand, you're going to have your carpal bones, which are down here, your metacarpal bones, which are going to be these ones right here, and then these ones down at the end, these are going to be your phalanges that have to do with your fingertips. Oh, sorry. I wanted to talk about metacarpophalangeal. That one there has to do with the different, like the whole area. So we're referring to this entire area of all of it. Right. So now we get into the pelvic girdle, and these are the bones of the pelvic girdle, otherwise known as your pelvis. We've got our ilium, our acetabulum, our ischium, our pubic arch. And then now we go to the hip and the thigh area. So this is where your hip socket is. So if you've had people who've had a hip replacement, it's typically this part right here that's cracked, and then they need a whole either hip replacement or they put a rod in here that fixates it so that way it can heal up and they can walk again. All right, so we've got a couple of terms here. We have our ischium and our ilium. We just need to make them plural. Now we go down to our knee joint. Our knee joint on page 477. And you've got your femur and you've got your femur up here, and then this side is going to be your tibia. Your tibia and your fibula are going to be the lower, or the bones of the lower leg below the knee. Your femur is going to be a big fat one up by, on your thigh. And then we have our foot, and same concept as our hand, except for down here, instead of these bones here being referred to as carpals, these are referred to as tarsals. And then we have another term, metatarsal phalangeal, again pertaining to the metatarsal phalangeals. All right, give the common name of the following medical terms. These have to do with bones of the foot. So our calcaneus is the heel bone. The talus is the ankle bone, and then the metatarsus is going to be foot bone. Disorders and injuries. So here we have osteoporosis. You can see on the left-hand side, this is microscopic level. This is really digging in. Yes, our bones have all these air pockets in it. That is normal for a bone. But if you look on the right, this is an osteoporotic bone. See these big gaps in here? That is going to cause a risk for fractures. Here's some other diseases of the bone. So we have osteoporosis, osteomyelitis, osteomalacia, achondroplasia, osteogenic sarcoma, and osteogenic imperfecta. All right, identify and define the suffixes from the term. So obviously we're just dealing with the suffixes. So we have plasia, malacia, oma, and penia. Bone fractures. I'll let you guys read up on these different types of bone fractures. There are several, and let's try to find where they're located. There's a picture on page, or a figure on page 482. It's figure 1420. This gives you a picture of what these look like, or what the actual fractures look like. And then when it comes to healing of fractures, this kind of shows you what the healing process of the fractures are. All right. So some things for you to do on your own. What's the difference between a closed and an open fracture, a complete or an incomplete fracture, a pathologic versus a compression fracture, and what's the definition of the abbreviation FX? So now we go to the diseases of the joints. And you have osteoarthritis, rheumatoid arthritis, juvenile rheumatoid, bursitis, and hallux valgus. Our spine, we've got conditions of the spine. You have scoliosis, kyphosis, and lordosis. Right. Identify and define the root element for the following terms. What is it? Pro. Okay, quickly, now we go into procedures and pharmacology. Arthrography or arthroscopy. Arthrocentesis. And we already did arthroscopy. Arthroplasty. Arthrodesis. And that is it for the skeletal system. The next chapter we're going to be doing is chapter 15, which has to do with the muscles.